Hi, my name is Lisa Gibbons, and I'm an OB-GYN with Cascadia Women's Clinic in Vancouver, Washington, and was asked to talk about in vitro fertilization. As a practicing OB-GYN in general practice, this is not a procedure that we perform, however, refer plenty of couples who are having infertility difficulties to a reproductive endocrinologist who does perform this procedure. That's an area of specialty for infertility, and in vitro fertilization is one of the possible treatments for infertility once the couple's been worked up and found to have certain underlying infertility issues. In vitro fertilization was first performed in 1978, and Louise Brown was a child that was conceived via this process. So it's been around for quite some time, and the success rate has certainly gone up since that first baby was born via in vitro fertilization. The process involves potentially stimulating the female with hormones to produce an overabundance of ovulatory eggs that are retrieved from the lady, and taking sperm from her partner, incorporating the two together, and outside the human allowing those to grow a gamete staged zygote for reimplantation into the uterus. This process involves a lot of medical intervention and is done with the reproductive endocrinologist assistance. Some of the more common reasons why couples would be appropriate for in vitro fertilization include, most commonly, tubal or fallopian tube factors for infertility. So ladies who have had either surgeries or scar tissue to their fallopian tubes or complete removal of their fallopian tubes for whatever reason would be a perfect candidate for this. Male factors, so low sperm count or absent sperm count, can be also a cause for this, and using male donor sperm is a possibility. Other reasons include unknown infertility, so you've tried everything else, then this may be recommended by the reproductive endocrinologist, or immunologic disorders that specifically affect infertility would be a reason as well. Endometriosis can be another reason for ladies who have significant endometriosis, and specifically tubal factor or inability of that to convey an egg to the uterus. So in closing, infertility is something that is typically diagnosed after a year of trying for a couple under age 35, or for a lady who's 35 years or older in 6 months time period. If you've been trying for some time and are having difficulty achieving pregnancy, you may want to talk to your OB-GYN about whether or not this would be an appropriate technique or step for you, and an appropriate referral to a reproductive endocrinologist.